Hi everyone, my topic is learning disabilities. So, learning disabilities are a group of neurodevelopmental disorder that can significantly hamper a person's ability to learn new things. So, as a result, the person may have difficulty with speaking, reading, writing, understanding the information, and remembering the things. So, what is learning disability? A heterogeneous group of disorder characterized by persistent difficulty with learning academic skills in a variety of domains, which includes reading, spelling, written expression, and mathematics. So, what are the causes of these learning disabilities? If the mother was suffered from illness during the pregnancy time, it may affect the children's mental ability. So, problem during the birth that stop enough oxygen getting to the brain, the unborn baby having some genes passed from the parents, which may also cause, which may also a reason for the learning disability. So, illness such as meningitis or injury in early childhood disability also results in these type of learning disabilities. So also the people with Down syndrome, epilepsy also have these disabilities. So what are the signs and symptoms of these learning disability? So if a child struggle with reading and spelling while another loves books but can't understand maths. So these are all the symptoms of learning disabilities. So types of learning disabilities. First one is dyslexia. Here the students have difficulty in reading. It can be classified into two. Basic reading problems occur when there is difficulty in understanding the relationship between sounds, letters and words. So reading comprehension problem occur when there is an ability to grasp the meaning of words, phrases and paragraphs. Signs, letter and word recognition, understanding words and ideas, reading speed and fluency, general vocabulary skills. These are all the some of the things which is lacked in the learning disability students. Second one is dyscalculia. Here the students are difficult in doing the mathematical problem, so which is known as dyscalculia. Dysgraphia, learning disabilities in writing. Here the students may struggle to express their thoughts and ideas in a written form. They also lack the neatness and consistency of writing, spelling consistency, written organization and coherence. Dyspraxia, here the students have problem with movement, that is motor skills. So some of the problems that which affects the learning disability students, they are difficult to coordinate the hand and eye, like holding a pencil or buttoning a shirt. Dysphasia, language and communication learning disability is called dysphasia. Here the children may have a problem with verbal language skill such as ability to tell a story, the fluency of speech, ability to understand the meaning of words and directions. Auditory processing disorder. It is the ability to hear things correctly greatly impact the ability to read, write and spell. So professionals may refer to the ability to hear as well as auditory processing skill or receptive language, an inability to distinguish subtle differences in sound, making it difficult to sound out words and understand the basic concepts of reading and writing. Visual processing disorder. Problem in visual perception include missing subtle differences in shapes, reversing letters or numbers, skipping words, skipping lines, misperceiving depth or distance, or having problem with eye-hand coordination. Visual perception can affect motor skill, reading comprehension and mathematics problem skill. Attention deficit hyperactivity disorder is not considered as a learning disability, but it also disrupts the learning process of the students. So the children with ADHD often have a problem with sitting, staying focused. They may not able to follow the instructions which was conveyed by the teachers, and they lack the they also do procrastination while doing homeworks. Autism. Children with autism disorder may have trouble in communicating, reading the body language of the opponent person, learning basic skill, making friends and making eye contact. Profound and multiple learning disability. Here, the person may have a multiple learning disability. For example, if a one person have a disability in reading, if another person is disability in listening, it is considered as learning disability. If a single person have these all learning disabilities, then we call it as a multiple learning disability. So, two types of testing devices can be used. First one is non-testing devices and second one is employing test devices. Some techniques are given to mold the children with learning disability. First one is behavioral approach, psychoanalytical approach, individualized instructional approach, self-instructional approach, multisensory approach, technological approach. So, role of teachers in educating the students with learning disabilities. First, the teacher have to build connection among the students, then listening to the students, proper classroom accommodation, let the students to be independent, flexible teaching structure, involving parents, providing a safe environment. With that, we can conclude it is important thing to remember that most kids with learning disability are just as smart as everyone else. So we need to identify their difficulties in learning and we have to provide a safe and secure environment and make the children to learn better in the particular environment.